Right. Welcome everyone to this renewed version of this webinar, which we tried to hold a few weeks ago, but which we are organizing again today. Now that we could solve a few technical issues, I will now give the floor to Marie-Claire Foblets, who's chairing the discussion today, and we will act as a moderator. She will give a few words to introduce the discussion.
You hear me, Luc?
Yes, we can already hear you, Marie-Claire.
Well, as we agreed, I will not take longer than 2 or 3 minutes just to introduce this 1 hour of, I'm completely confident, highly relevant discussion, just to just explain how I see the relevance of this discussion today. Selective migration policies, as we know them, in particular in Europe, I'm afraid will never meet consensus as long as they are, as we all know, the reflection of political agendas that are in fact balances of interests that are not even-handedly taken account of. Let me put it a bit more bluntly, some interests matter more than others. Now, what the Vulnerable project is striving at is to show how this kind of disequilibrium, some interests matter more than others, hits in a particular harsh way some individuals and groups, namely the vulnerable individuals and groups. And then the question of the Vulnerable project is, what can be done to restore, to a certain extent, the balance in line with human rights requirements? That's how I understand the Vulnerable project. Yet, with the global-wide health risks that have come with the pandemic, there is all reason to believe that the balancing of interests to which decision makers have proceeded the last months follow the same logic. Some interests indisputably have come first. And in line with its mandate, Vulner, with this meeting, seeks to offer a platform to critically discuss some of this reflected, but partly maybe also unreflected, prioritization of some interests over others. For in particular vulnerable groups of people who for their protection depend on a more appropriate migration policy, programs, measures. And today we will discuss in particular ill people in Canada, caregivers who are employed outside of their home country, unaccompanied minors waiting to be relaxed from the confinement on one of the Greek islands, just to offer illustrations of situations that have remained so far relatively under-documented. The Vulner project will take our today's discussion, I'm sure, further in its endeavor to contribute to the documenting of how EU-wide in this case, the lens of vulnerability allows for a more accurate analysis of how to seek justice in individual situations. And by bringing these individual situations together, also by means of truthful empirical data, and put them then at the service of a forward-looking approach to better balanced migration policies. It's a huge ambition, but it will start with discussions like the one we will have today. I wish everybody good luck, but I have also a little bit a less pleasant job that Luc entrusted me today. I have to watch the clock, but this is not just to discipline you, but it's for the benefit of having also sufficient time for the Q&A after. So I would say we begin with Luc, because Luc, I don't know whether I summarized correctly the endeavor of Vulner, but you will do it much better. So the floor is yours now.
All right, thank you very much, Marie-Claire, for this kind introduction. What I will do in my presentation is to discuss the measures that have been adopted at EU level in an attempt to coordinate member states' reply to the epidemic, And I will do so while laying the emphasis on how a focus on migrants' vulnerabilities might allow us to better understand, document, and analyze the consequences of these border closures measures on migrants. I think everyone is aware of the fact that in an attempt to to limit the spreading of the epidemic, many EU member states have started closing their borders. Some measures have now been lifted, but some are also still remaining into place. These multiplying border closures were decided on the basis of, among others, the Schengen Borders Code, and led the European Commission to adopt some guidelines with the view to coordinate, have some minimal coordination, let's say, of these border closures decided at member states level. These guidelines emphasize the need to respect the requirement of proportionality. They highlight the need to always guarantee the free movement of goods and services, and the need also to conduct health checks on people who would like to cross the border whenever possible and whenever appropriate. These guidelines also emphasize the requirement to act in a spirit of solidarity among the EU member states, for example, by making sure that there is sufficient coordination with neighboring countries before closing the borders. The guidelines further launch an invitation to the member states to close the external borders of the EU, which was decided indeed by a decision of the European Council of last March. There are now discussions to lift these measures partially, but this has not been decided yet. This reaction by the EU institution are interesting in and by themselves as they reveal the underlying governing principles of the Schengen area. They reveal the principles that were set in motion following the 2015 refugee crisis, with first an emphasis on solidarity among the member states, which concrete consequences remain very unclear, however, and second, the strengthening of the external border of the EU. This raises the question, however, of the consequences of these measures for migrants. The guidelines are clear when it comes to those migrants who are legally residing within the EU. It's clear that they have the right to return to their country of legal residence. There is even this requirement of other countries to allow these third country nationals and EU citizens who are living in the member states other than their own to transit through their territory to reach their member state of residence. Other migrants, however, are facing multiple issues and have been documented by the Fundamental Rights Agency, among others. These issues relate to access to protection, as search and rescue operations within the Mediterranean Sea have been suspended, and as some Dublin transfers have been suspended as well. They also relate to access to the reception conditions for asylum seekers, as asylum procedures have been suspended in some countries. And finally, they also affect those migrants who are staying irregularly in Europe and are being confronted to prolonged detention as a result of the suspension of return procedures. In light of these events, the European Commission came up with yet another set of guidelines in which it emphasized the need for the EU member states to keep implementing the acquis despite the sanitary crisis. It emphasizes the need for the member states to find solutions so that the acquis keeps being implemented despite health measures that must also be adopted. There is this suggestion, for example, to set up an online registration procedure for asylum seekers. These guidelines are interesting because they lay the emphasis on vulnerable migrants. They send a message to the EU member states that when implementing the acquis in this context of sanitary crisis, particular attention must be given to vulnerable persons. It's not unique to these guidelines. This call to take care of vulnerable persons in this context of pandemic is also made by the UNHCR in its practical recommendations and many other civil actors from the civil societies. It has been made as well by the European Parliament in its resolution on how the EU should act to fight the pandemic. It has led to very concrete initiatives, such as the relocation of vulnerable asylum seekers, including unaccompanied minors, from Greek refugee camps to other EU member states, which is something that will be discussed by another speaker. What I will do in this presentation is rather to try to start reflecting on what's behind this policy emphasis on vulnerable migrants and how scientists and this Vulnerable project can help reaching that kind of policy objective. Behind this focus on vulnerable migrants, there is this idea of identifying those who are in need of specific protection. The objective is to better tailor asylum policies to the realities on the ground by giving adequate care to those who are more disadvantaged than others. Behind this focus on vulnerabilities, there is a certain conception of society, which is a society that takes care of its weakest members. This very generous objective should, however, not make us blind to the side effects that can come from such policy focus. If one has a stereotyped understanding of the vulnerabilities that are being lived by migrants, then one risks to focus on some groups at the expenses of others. There is a risk of setting in place additional protection with the objective of reaching concrete equality, but in the end, exacerbating existing inequalities by focusing on some groups at the expense of others, because these groups are actually not particularly vulnerable. To avoid that kind of pitfalls, it is necessary to have appropriate scientific evidence and analysis that allow us to better understand the realities and vulnerabilities that are actually being faced by migrants. This is something we aim to do with the Vulnerable Research Project by using vulnerability as a theoretical and analytical framework to analyze the situation faced by migrants. We aim to identify existing vulnerabilities, but also by taking a step back, by having a look at how these vulnerabilities are often being produced by the overall regulatory framework, and more importantly, maybe, how they also affect individuals differently, depending on a multiplicity of factors, depending on their intersecting social identities. We also aim to do so by unveiling the underlying policy dynamics that are at play. When there is a policy choice that is being made to give a preferential treatment to some vulnerable group, then this has hidden exclusionary effects. These effects are not problematic in and by itself if their objective is indeed to correct some vulnerabilities, but one needs to be aware of them to avoid, again, that these exclusionary effects are based on a stereotyped understanding of vulnerabilities, and in the end, lead to the most favored treatment of some group which is not being justified. Finally, let's not be naive. Of course, migrants have agency. Of course, migrants have resilience and coping strategy. And it's important to also be aware of the fact that they will make use of the vulnerability categories in a way that will support their survival strategy. It is something important. It is something that needs to be supported, of course, but it's something that must be properly documented and analyzed as well to avoid a vulnerability contest, which in the end the most vulnerable will not be able to win. I will now give the floor to the next speaker. We will address the issue of the relocation of unaccompanied minors from Greek refugee camps. So, Jessica, the floor is yours.
Thank you. Does everyone hear me?
Yeah, perfect.
Good. Thank you, Luc. My name is Jessica Schultz. I am a postdoc at the University of Bergen, and in my presentation today, I will be giving you an overview of the situation for unaccompanied minors in Greece and discuss the efforts to relocate some of them to other countries in Europe, including what criteria are being applied and some of the dilemmas being raised by these efforts. But first, before going into the specific situation in Greece, I just wanted to highlight some of the impacts of the current COVID crisis on asylum-seeking children in general. Luc had mentioned some of the direct protection threats posed by public health measures, including containment in camps, border closures, forced returns by land and by sea. In some countries, including Greece, unaccompanied minors are also being subject to protective detention for extended periods of time, often in cramped quarters and with adults they may not be related to. But I also wanted to point out some of the kind of indirect protection threats that the current crisis has created through the effect of the response on the asylum system and existing support structures. The delays in assigning guardians, reduced access to legal advice, and especially the suspension of processing has had a disproportionate effect or impact on minors, particularly unaccompanied minors, for whom every month counts when it comes to having their protection claims recognized. As I point out in the slide, that magical number 18 often signals the end of protection for unaccompanied minors in member states, and therefore they become sort of out of status, and even outside the COVID context, many of them sort of disappear and go underground or to other countries. So that particular dynamic is intensified as a consequence of the corona pandemic. I also wanted to point out that the lack of the digital solutions being pursued in many countries to reduce face-to-face contact, the lack of in-person contact poses challenges to migrants or refugee claimants' right to be heard, especially for children's rights to be heard. And we know research shows that asylum outcomes are highly dependent on the possibility of having in-person, face-to-face meetings. A word about the Greek island hotspot camps. First, many of you who are listening to this webinar have certainly read a lot about them. But the first reception facilities on the Greek islands, known as hotspots, were established in 2015. And following the EU-Turkey deal in 2016, they have been transformed from transit centers to overcrowded camps served mainly to contain asylum seekers while they wait for return to Turkey, to their country of origin, or to mainland Greece for processing of their claims. The capacity for the hotspot camps on the 5 Greek islands was just over 6,000. Today, there are more than 42,000 protection seekers, of which 1,600 approximately are unaccompanied minors. Total in Greece, including mainland Greece, there are an estimated 5,000 unaccompanied minors waiting for a durable solution. The overcrowded, unsafe, unsanitary conditions on the camps are well documented. I think in addition to poor access to food, water, health care, it's worth mentioning that the areas that were set out to house unaccompanied minors are totally overcrowded, and many minors are living in overflow areas on their own or with adults that they don't know. There's also been at least, I think, 5 deaths in Maria camp and at least 15 serious injuries as a consequence of stabbing. So there has been an increase of violence triggered by the poor conditions and delays created by the COVID-19 response in Greece. The 7-week lockdown in asylum processing in Greece in March and April has meant that those most at risk of complications or death as a consequence of the virus have been stuck in the camps, which thankfully have not yet seen an outbreak of the virus. In early May, the Greek authorities finally transferred several hundred people to the mainland. But I should point out that changes to the asylum legislation in Greece mean that even recognized refugees must leave their camps and subsidized facilities after 1 month now and find their own work, which means that many vulnerable recognized refugees, including families with children, are sleeping in public squares and parks, even on the mainland in Athens. Before, as Luc mentioned, I mean, there have been kind of intensified efforts to relocate unaccompanied minors, but in fact, relocation is one of the operational functions built into the Hotspot approach. So relocation of unaccompanied minors has taken place in the past. There have been 3 previous relocation efforts from Greece, Italy, France, and Malta, which have included unaccompanied minors, and calls for the urgent evacuation picked up last autumn when the European Commission began approaching member states to relocate. In March 2020, the EU Commission announced that 11 countries would relocate 1,600 children, mainly unaccompanied minors. These countries are listed on the slide. In addition, the UK has relocated children who nonetheless have a right to family reunification under Dublin. And then other countries such as Norway are kind of taking a holding position. They've made commitments to relocate children, but are waiting for other countries to actually go through with actual relocation before they themselves do so. So it's a kind of wait and see attitude. On the islands, UNHCR, the European Asylum Support Office, or EASO, Greek NGO partners, and the Greek Ministry of Migration and Asylum involved in best interest assessment have been active, and they've also helped to match unaccompanied minors to member states who often have their own specific criteria for who they're interested in relocating. Onto the criteria, UNICEF, UNHCR, and IOM have worked together to establish standards for which children will be identified and prioritized for relocation. I've given you the link on the slide of the description of those standards. But basically, these standards are rooted in international child rights legal frameworks, including the Convention on the Rights of the Child and the 1951 Refugee Convention, in addition to humanitarian principles. Maybe just a couple words, legal and physical protection needs. Here, the main, although not the sole issue, is whether the minor would qualify for refugee status or another stable legal status in the country of relocation. We have family reunification. Family unity is a major priority in the best interest assessment and the interviews with children. Humanitarian factors, even length of time as a protection seeker. How long has the child been in the situation of being an unaccompanied minor is also relevant. The principle of do no harm in this case relates to concerted efforts not to discriminate against vulnerable minors, which means that distinction between groups, whether based on nationality or other factors, have to be justified and proportionate. Do no harm also refers to efforts to safeguard against creating incentives for children to arrive unaccompanied, which could result, for example, if children without other vulnerabilities from safer countries of origin are prioritized. Now, one of the dilemmas or the challenges here is how not to discriminate and how to negotiate the tension between a needs-based assessment and the priorities that I mentioned that receiving states themselves set as a political decision.
Jessica, can you watch the clock, please? And maybe come to a kind of conclusion, or what
yes,
you would like to bring in the discussion? Yeah.
This is my last slide. The time, I just want to point out four actually dilemmas that I see with these the current relocation process. One is the timeline, which relates to the fact that proper best interest determinations, the assignment of guardians, etc., plus the security and health checks that member states require take time. And this is in tension, obviously, with the urgency of the current situation and the potential for an outbreak. Vulnerability, as I discussed before, I won't do this again, but vulnerability is just one criteria among others. And receiving states may have their own criteria, which might include nationality, sex, age, language skills, presence of family members. A third tension I see relates to the zero-sum logic that you see in some of the political discourse. For example, in Norway, the possibility of relocation has been set by some politicians against existing resettlement quotas. So the question is, does this relocation come in addition or instead of other commitments? What about other vulnerable groups who aren't unaccompanied minors in need of urgent protection? And this idea of helping them where they are, giving greater assistance in the camps or to mainland Greece versus access to asylum. And then the fourth dilemma I want to point out is the fact that that it's up to the member states to conduct their own assessment of the need for international protection. So although there's no guarantee of asylum, it's important that children relocated under these schemes are not granted, for example, time-limited permits, which forces them then into another risky return situation. I'll stop there, and we can take some of the
Thank you so much. There are questions to you, but we will come back to you then later. No? Can I maybe invite you, Sabrina Marchetti, to introduce us into what you would like to bring in terms of illustrations of vulnerability, namely the caregivers?
Yes, good evening, everyone. I will focus, if Jessica, you stop sharing, I will start with mine. And my own case study in this conversation is the one of caregivers who are employed in several countries, but in Italy in particular. Let me share the screen and here we come. As many of you may know, during this pandemic crisis, caregivers, many of whom are of migrant origin, have been under the spot for being one of the categories of the so-called essential workers, which has been particularly hit by this crisis. We will go into the reasons why, what are the factors of this impact, this negative impact on them. But before going into that, I would like to spend a second on a reflection on why we call them essential. We have this large category of essential workers. Caregivers are some of them, but we know they are also, among essential workers, we have also many other types of jobs, from people working in supermarkets, cleaning the streets, making deliveries, and so forth. So we came to, with this crisis, we came to realize probably what are those basic, fundamental, essential kind of activities without which, as they say, the world stops. Without us, the world will stop. And these are the activities that are needed to make the society run in general, I would say, not only in this particular situation. However, I'm sorry, I'm going back to the slide. However, we are all now facing the needs of a society which is ill, a society which is at risk of being very ill. And therefore, people working in jobs in the care sector, in the health and care sector, are particularly needed. So not for the regular functioning, for the specific functioning on a health crisis, as we said before. This perspective is very interesting when we speak about Europe as an aging society, as a society generally at risk of illness for the aging of its population and the impact of different type of chronic diseases on our population, and Italy is one of the countries with the most aging situation. But why the people working in this sector are then at risk themselves? They are at risk at two levels. One is at the risk of being themselves infected with the COVID-19 flu. And the other one is that beside the health situation, they might lost their jobs. Yeah, I've listed a quick bullet list in which is summarizing. They may lose their service and residence permits, whether the care receiver survived the pandemic. So we might think that some of the care receivers have died or have moved to a hospital, so they no longer need home-based care services, or in the employer's households have concern on health issues, so they don't want external people coming into their places anymore, or they themselves might be concerned about their own health situation, the risk, they want to stop working, they would like to go back home in their countries of origin, but they cannot go back because traveling back home is not that easy in this moment, and of course they will also lose the job. In general, I also want to speak of, I also want to mention of an issue of racism which might affect this entire scenario. And we know from previous pandemic that in most cases, migrant people often associated with the countries of origin of the pandemic have been put under special spot for some racist attacks. That happened in Italy in the very beginning of the pandemic in January. It is happening again because I don't know if you know the recent news that the new let's say clusters of infections in Italy do concern many migrant families. We could look at this issue from many different angles. We could look at the way employers, so the households where the care receivers work, are reacting to this situation. We could look at the side of the workers themselves, associations of workers, trade unions. I'm here quickly today mentioning the way governments are reacting to that with the specific case of the Italian government, where, as you know, in Italy, as you may know, in Italy, there are more than 2 million people working in the sector, majority of them are migrant women. For the case of the Italian government, we can look at two different steps. The first one was the one happening in March with a decree, presidential decree called Cura Italia, Care Italy, which paradoxically, maybe given the title of that decree, did not take in any consideration, that was not mentioned at all of the case of caregivers. That negligence has provoked a lot of reactions. I was also involved in an appeal by scholars and trade unionists, etc., on covering that kind of lack of the decree. And therefore, we have now a second decree that covers the period of April and May, which is called Decreto Rilancio. Therefore, finally, in this decree, we have the caregivers, I'm speaking of home-based caregiving, have to wear protections, masks, etc. That I put here on the slide the number of the article mentioning that. They will also, as all the other jobs, receive a subsidy for facing this economic crisis, which is 500 euros per month. So for the 2 months of April and May, it remains a mystery why all the other workers in other sectors receive 600 euros and domestic and care workers 500 euros. I don't know why this 100 euros discounts on their cases. There is another limitation that while all the other workers do receive they receive an allowance in order to pay for babysitting for their children, because children could not go to school, as you know, and nurseries. If you are a caregiver, you will not receive an allowance for the babysitter of your own children. So probably you're supposed to be only babysitting the children of someone else, but you're not supposed to have your own children at home with probably a babysitting need. They are not paid a sickness leave, and this is a problem that is generally present in labor contracts for caregivers and domestic workers. So sickness leave is not paid. The new decree is offering a measure that people are discussing these days, that is a a regularization, offering temporary residence permits of 6 months based on work contracts that are 6 months for looking for other jobs in the future. But these are concern only people who are currently employed. They can show to be currently working and having a contract in the caregiving and agriculture sector. No other sectors are involved. This also includes people who do not have a residence permit. So that is both for Italian workers who do not have an employment contract in this sector, and for migrant workers who do not have not only an employment contract, but also a residence permit. This decree has been, this measure for the way it's going to be implemented and for the fact of being limited only to these 2 sectors, although very important sectors, as we all may agree on, this measure is currently very criticized by the side of organizations supporting migrants and workers. I will stop here, and I'm happy to answer to questions on these measures in the Q&A time.
Thank you so much, Sabrina, and also for having been so concerned about the time, which will allow us now to pass to Delphine. The floor is yours, Delphine, far away from Europe.
Hello, thank you very much, and good morning or good afternoon, everyone. So I will start sharing now. Okay, so in my today's presentation, I will actually discuss the impact of COVID-19 on 3 different groups of migrants in Canada. The first one, very briefly, about medically uninsured migrants, because this is a real issue in our country. The second one,
can you speak a little bit
working...
louder, Delphine? Can you speak a little bit louder?
Yes,
Thank you.
Sure, let me see if I can. Can you hear me better now?
Well, yes, here in Halle, yeah.
Okay, perfect. So yes, so the first one about medically uninsured migrants, which is a serious concern in Canada. The second one, migrants working in essential positions, and this will be linked to Sabrina's presentation. And the third point about refugee claimants at the United States-Canada border. So I will even increase the volume a little bit. Let me know if this is too high or if this is good. So in Canada, let me see. In Canada, actually, several categories of migrants lack government-sponsored healthcare insurance and do not have private insurance or the financial means to access healthcare. These migrants are very many groups of migrants. They include temporary migrant workers who work between 2 contracts, international students disqualified from coverage for a series of reasons, non-citizens, family members of Canadians who are in the country on visitor visas while awaiting for the approval of their sponsorship applications, failed refugee claimants, or again, of course, undocumented migrants. In response to the COVID-19 pandemic, some provinces have begun to temporarily expanding some types of coverage, largely through making a distinction between COVID-19 related services and other services. However, on the ground, it is really difficult for healthcare providers to know what constitutes a COVID-19 related service only. Several patients are still denied access to essential COVID-19 related healthcare by institutions that are not familiar with this type of population. And thus there is currently no guarantee that health assistance provided to migrants will not impact their status. Many undocumented migrants do not seek medical treatment or testing due to the fears of being detained or even deported. This situation is problematic for many reasons, but of course, one concern is also that this may potentially increase community transmission and healthcare costs. There is currently in Canada an important movement asking for an extension of essential healthcare access to all migrants. The reason for this push is that many of the migrants who cannot access healthcare are in fact working in industries that are considered as essential during the COVID-19 pandemic. Cleaning services, healthcare, food supply chain, and they are risking their lives while working. So I just wanted to put the name here of some of the unfortunately many migrants who died during the COVID-19 in Canada. in memory of all the work and the contribution they did. But clearly, inability to work remotely, physical proximity with co-workers and customers, lack of adequate protective equipment, etc., make these occupations particularly risky. And especially, and I think this is important to highlight, as migrants tend to work in the most precarious positions in any of these sectors. Interestingly, the Canadian government is working on two specific programs. One of them, which is not in place yet, would give refugee claimants a pathway to permanent residence if they worked in healthcare during the COVID-19 pandemic. There is also the Agri-Food Pilot Project, a program enabling workers in very specific occupations working outside of Quebec to obtain permanent residence. However, for many other migrants, obtaining permanent residency is not an option, despite the fact that they are considered as essential during the pandemic. And a good example is migrant farm workers. Close to 70,000 migrant farm workers came to Canada in 2019. Central to Canada's food supply, many of these migrants are admitted into Canada under very strict conditions and for a very specific period of time. Despite the announcement of border restrictions in March 2020, the Prime Minister announced that migrant farm workers, as well as fish and seafood workers, would be allowed entry because they are coming for, and I'm quoting here, this is in the decree, an essential purpose. When migrants arrive in Canada, their health is assessed and they are subject to a mandatory 14 days isolation period. This quarantine period is imposed to everyone, including returning Canadian citizens. The government published COVID-19 guidelines outlining expectations for employers of migrant workers. However, these guidelines leave too much discretion on employers. They also fail to outline strong regulatory measures necessary to protect the workers. So as a consequence, healthy and ill people live in the same crowded bunkhouse. There is no translator, even when workers are treated for the virus in intensive care. Increased intimidation, surveillance, and threat from employers, often under the guise of the COVID-19 protocols. Hundreds of migrant workers have tested positive for COVID-19 across Canada, and this is continuing. They arrive in Canada in good health. They are compliant with the 14-day quarantine protocol. These cases underscore the need for better rules and regulations around housing, occupational safety, and healthcare coverage. And specific recommendations have been made lately. I could come back to this recommendation later if you want. Last but not least, refugee claimants at the US-Canada border. So there is in Canada a safe third country agreement between the United States and Canada. And the consequences of this agreement is that refugee claimants who present themselves at an official border crossing in Canada or the US must request protection in the first country in which they arrived. Concretely, what does that mean? The huge majority of claimants come from the United States to Canada. When they make a claim for protection, they are sent back to the US unless they qualify for one of the few exceptions to the agreement. For example, if they have family members in the country, in Canada, or if they are unaccompanied minor. It is important to understand that under normal circumstances, the agreement, and this is really important to understand that, does not bar refugee claimants from seeking protection once they are inside the country. Thus, as long as refugee claimants do not enter Canada at an official border crossing, they can apply for refugee protection once in Canada. Not surprisingly, with increasing numbers of refugees worldwide, and given political and policy shifts in the United States, the last 5 years saw an increase in the number of people crossing from the United States to Canada to make refugee claims. Because they would be sent back to the United States if they make a claim for refugee protection at one of the official border points, many resorted to crossing the border irregularly, i.e., between official border posts. Once in Canada, they usually present themselves as soon as they can to the authorities so that they can make their refugee claim. Of course, there are security concerns associated with refugee claimants crossing irregularly. You know that in Canada, we have a very cold winter, So amputations due to frostbite in the winter months, high smuggling fees, etc., etc. However, these irregular border crossings were fairly well managed. Processing was in place. Security, criminality, and health screenings could be conducted. Asylum seekers were connected with support organizations, and their refugee claims moved forward. And it is also interesting to note that many, actually more than half of the claimants who came irregularly were recognized as refugees in Canada. To prevent the spread of COVID-19, Canada temporarily limited access to its territory, except for its Canadian citizens, permanent residents, and some of the migrant workers considered as essential, as I highlighted before. So what they did as well is that they actually, let me see where I am. Okay, so there was also a new agreement between Canada and the United States saying basically that any claimant entering Canada will temporarily be sent back to the United States. The problem with this agreement is that there is no insurance from the United States that claimant falling into its custody won't be arrested, detained, or deported to their country of origin. So I will stop in 1 minute, but what I just wanted to say here is that if you want, once the border was closed, the US Safe Third Country Agreement was no longer accepted any claim made at the border, including those with exceptions. And they also said that anyone who crossed the border irregularly would be sent back to the United States temporarily. But the problem is that there is no insurance from the United States that those turned back are not detained or deported. And so since then, most of the Safe Third Countries Agreements exemptions have been restored, but irregular claimants are still returned to the US with no guarantee that they will not be deported or detained. So this is having a pernicious effect because what we are seeing, in fact, is an increase in irregular entries into Canada, but this time without any medical screening, with more dangerous routes being used, etc., etc. So I just would like to conclude by saying that we are in a very strange situation in Canada, where border crossings to seek protection against persecution are being curtailed because they are not considered as essential travel, but in the same time, border crossing to facilitate the work of essential workers are allowed. It has also become clear during this crisis that migrant workers are essential and they remain inadequately protected and their contribution is not equally recognized. Thank you.
Thank you so much to all the speakers, and also thank you for respecting the time. Let's make the best of the remaining time. Anyhow, this is the beginning of Vulner. So there will be ample opportunities to come back to your testimonies that are by far too rich to be condensed in each of them 10 minutes. In the meantime, we collected 5 beautiful questions, each very different from one another. And what I will do, and I think the instruction comes from Luc, is to collect the questions and then up to you to see to which one you would like maybe to react. The first question, Luc, is indisputably to you. It's the concept of vulnerability. So a person says, well, since there is no kind of definition, unique definition, how does the project define vulnerability? And another kind of also conceptual question is to you, colleague Schultz. It's the question of why do you use the term protection seeker and not asylum seeker? Is there a reason why you opt for using that term? And then also to you is the question of the practice when there is doubt about the age of a person. How do the practice deal with doubts about age and the evidence of age? Yeah? So that's the other question also to you. Then there is one person who has more an observation than a real question. It's a bit the cynical situation within which we all know that societies are. There is also exploitation of undocumented people. Industries largely benefit from undocumented people. What do we do about this harsh reality? And then the last kind of intervention was more about a fear or a risk, and it's to you, Sabrina. since, but I don't know whether there is evidence for that, but that the working conditions are better for care workers in other European countries, isn't there a risk for crossovers, that people go to these other countries? And do you see that as a risk? Yeah. These are the questions I collected, and I'm very tempted to abuse of my position to ask to you, Delphine, since there was no question to you. I think everybody agrees on the importance of ensuring access to essential health care. Now, in Europe, there is the problem of the definition of essential, because if you're too narrow in defining essential, you add risks, because the people will wait until it becomes essential, and all the risks that come with waiting until it is essential. But I don't know to what extent, now Luc, I speak under your authority. I think if everybody really sticks at the question that is really addressed to her or to him, in the case of Luc, then I think we will manage to have a beautiful 5-6 minutes, and then the floor is yours, Biao. No? But let's maybe start with you, Luc. What do you understand with vulnerability for the project?
Right. Yeah. Thank you very much, Michael, and thank you very much for the question as well. Yeah, that's indeed a key question. No, it brings us actually to what this notion intends to do, and I think that's what makes it a particularly interesting notion. Vulnerability is a notion that allows you to depict the complexities of human experience. We are all vulnerable to some extent, and by using this notion, what we aim to do is really to depict what's happening on the ground. What are the realities lived by those peoples? That's one aspect. And the other aspect, of course, and that's where the legal discourse comes into play, is that you take this notion, which is used to depict complexities, which is used to depict what's happening on the ground, and you make out of it some kind of legal and policy concept that will give some rights and additional rights to some people. And you have to be aware that when you do that, there is a kind of translation that is taking place, and there are choices that are being made. They are not problematic in and by itself, but the way we want to address that is really by confronting these choices that have been made with the concrete realities on the ground. And that's where vulnerability comes into play, and that's where we use vulnerability to really depict what's happening on the ground, and then be able to look back at the choices that have been made at policy level when implementing that concept into the legal framework. So I hope that was the beginning of an answer to this very interesting question. Thank you.
So it's not really a doctrinal definition. It's a definition that will look at the context within which the vulnerability plays out to be a vulnerability.
Absolutely. It's a concept that allows you to have observations and to direct your observations in a certain direction.
Wonderful. Yeah. Thank you, Luc, and good luck with this approach. And then I switch to you, Jessica, if you could take the two questions that were really directly pointing at your presentation.
Sure. First of all, I don't know, Luc, if you'd like to say something about the use of the term protection seeker as opposed to asylum seeker is something that we have taken on a project-wide basis to suggest something wider than an asylum seeker. But perhaps, Luc, would you mind answering that sort of on behalf of the project? If you like, I can also tie it to UAMs.
Yeah, I can do it, but I must say something. It's a concept that Delphine Nakache already used as well. And the idea behind that was to actually allow for a comparison that goes beyond Europe, where we have in Europe this focus on asylum seekers because vulnerability has been used in the legal framework on asylum, but we also wanted to go beyond that and to also have a look at these procedures that exist for migrants that are indeed vulnerable, but that do not always fit within the very strict definition, legal definition of who's entitled to asylum, etc., etc. So we really wanted to broaden our lens in a way that will allow us to take also foreign partners on board. And maybe Delphine, you'd like to add on that as well.
She's fine with your answer. For the sake of time, Jessica, then the other question regarding the age and the evidence about age.
I'm not sure how the COVID crisis has impacted sort of general procedures when it comes to age assessment. The Greek authorities used risk X-ray dental screenings and so forth, which I can imagine have been suspended. But I think more commonly, IOM will work with its field offices in countries of origin to try and come up with some kind of birth registration or paperwork. So one thing I want to point out, though, is that that is something that is really striking about the criteria that receiving states in the relocation context have been very clear about, that they've been very clear to specify that they would like, for example, unaccompanied minors age 14 and under, of which there are quite, very few compared to the majority of unaccompanied minors, 15 or 16. So that's another dynamic that you see at play, specificity in terms of as young as possible. So presumably there isn't this issue of aging out in the near future, and even gender. Luxembourg and Germany, I think, also specified, at least Germany specified that they prefer girls and that sort of thing. So it goes into this whole question of vulnerability versus the priorities that are being set by receiving states.
Thank you so much. And I really hope that Vulner will address this issue that is already for years now on our mind. This is the sword of Damocles, not the age of a person. And how many people are really not under the stress of this age limit. So I think I switch to you, Sabrina, for the risk of people that look for better conditions in other European countries. Do you have experience? Do you have evidence of that?
Yeah, I started answering already in the Q&A, clarifying that maybe for people who are not familiar with EU regulations, if you get your residence permit for one country, that is not valid for another European country. So if you move to another European country, you will have to start again and finding a new contract, a new residence permit. And other countries who grant, at this moment, grant residence permits for work reason, especially when we speak of regular jobs in what are considered to be low-skilled jobs. I mean, there is no case. Now working permits now are mostly granted for highly skilled migrants, so to say, not for these jobs. So this is an opportunity. There's an opportunity to be in Italy. Of course, people then can decide to move to another country, but they will do that in the waiting the residence permit expire. More in general, I was saying that there is a concern, however, that people might apply for this regularization in a sort of bogus manner, with bogus contracts which do not reflect the actual conditions, so the real job that they've been doing until now, and also the actual intentions. So because this regularization is only for two labor sectors, care work and agriculture work, that means that many other people, including protection seekers, might pretend to be employed in these sectors, although they have not been working in those sectors before. There are articles in these days on newspaper produced by people from organizations, associations, as I was mentioning before. They're trying to say that creates a high risk. I'm following up on the question by François Crépeau in the beginning of the Q&A. This is the typical scenario in which it is the rule that creates the vulnerability of people, because what is happening now is that migrants, undocumented migrants, are desperate to find a way to fit in the very strict limitations of this regularization, and there are a lot of usually loan sharks, people who pretend to be their employers, offering to provide a contract for thousands of euros, 5,000 euros, 4,000 euros, which is an incredible amount of money for a migrant, especially for a migrant that because of the pandemic has not been working in the last few months. So there is that creates a spiral of indebtedness, not only of a legal precarity and so forth, but also of an economic dependency of these people on the usually that are lending them money for paying these possible bogus contracts.
Thank you so much, Sabrina. I don't know, Delphine, whether you want to react to the essential care definition. Otherwise, I see that we are running out of time. And now I switch to you, Luc, because I think it's maybe time to give the floor to you, Biao, and to just draw some conclusions from this very preliminary first discussion. And that will keep probably our Vulner partners busy the coming weeks and months.
Shall I speak?
Yeah.
Yes, thank you very much. I mean, that is a wonderful discussion, and because I know nothing about EU policies in migration policy in general, and also the policy initiatives that are taken up during the coronavirus in particular. But I think the concept of vulnerable is very interesting because this is a concept about the potentiality or a concept about propensity. We can say that all children are vulnerable, but normally we don't say the dying children are vulnerable because the dying children are dying. I mean, the fact is very clear. When we say children are vulnerable is to say there is a possibility that they may be put in a condition of harm. And I mean, as anthropologists, I mean, we always try to listen to what the people say about themselves. It's very rare for me to come across anyone who would describe themselves as a vulnerable people. I mean, they may be hungry, they may be under stress, they may be very ill, they are in pain, they are angry. They will just say they are hungry, angry, or in pain. They won't use the word vulnerable population. And the people who describe themselves as vulnerable, one group of people who have done particularly well are the generals in Pentagon, or the high officers in FBI, because they perceive themselves as being under siege. All the global terrorists are targeting the US, are targeting the White House. So therefore, the paranoia, all the global wars, and etc. So their self-perception of vulnerability is extremely consequential. So the reason I mention all this is I want to say that the concept of vulnerability is is interesting because it's lead to a potential. So therefore it involves a lot of assumptions and judgment and assessment. It is not something really we can empirically identify immediately. So therefore I think Luc's point is wonderful. And he said there's a lot of work of translation being involved. So if we want to use this concept, we have to figure out how we put the human face, put the concrete indicators, right, to figure out who these vulnerable people are exactly. I mean, so that is interesting to observe that the vulnerable population now somehow emerged as a policy category during this COVID crisis. So the policy category is also a very normatively constructed profile. So that I think raises lots of interesting issues, right? So that's a kind of normatively constructed profiles as a policy category. So I mean, so how are we going to follow from that? I suppose today's discussion really richly demonstrated all this. So my final point is I'm just wondering, without knowing anything about this topic, whether or not it actually is more helpful just to think of the notion of threats rather than vulnerability, just to identify what kind of threats these people are exposed to. I mean, then you go back to this classical anthropological writing about the vulnerability, like in India. Who regard themselves as vulnerable? Of course, it's not untouchables. It's the Brahmin priests and their wives and daughters. They are the vulnerable because they can be easily polluted. So therefore, they have to protect themselves. They have to invent all kinds of ideologies and institutions to protect their own vulnerabilities. I mean, this, of course, is a common mind now across the world. If you look at all the gated communities, private security guards, and etc. So, I mean, if you think of threat, you know, from their point of view, the Brahmins, they think there's such a threat out there among, threatening themselves. And then you ask the children in the refugee camps, probably we also can empirically identify what kind of threat they are facing, because this is something people can tell you and we can observe. And so probably we can take up certain measures to address these threats. So I don't know. I mean, again, I mean, I morally fully support these policy categories being written into policy communications, but now probably that is what we as scholars should do, right? To how to put it, the empirical meat, and so therefore make this category actable, something we can act on, and something we also can act according to. Thank you.
Well, I think on behalf of all of us, I would like to thank you, Biao, because in a way, what you says resonates to what Luc said more clearly under the heading of vulnerability, by using a contextual definition, by approaching vulnerability in its deep essence of interaction between how a person feels about itself, how the surrounding reacts to that situation. You, in fact, I think, come very close to one another. And then I come with my wish, Biao, that is that you keep an interest in vulnerability and that we can really continue working with you with your refreshing way of bringing in a completely different discipline, and that in 5 minutes makes us understand that you got the point, and we are very much close to what Vulner will document in the coming, how many years, Luc? 3 years. Okay. Thank you so much to everybody. Thank you also for the participants, and also thank you for the people we don't know, but who raised the very interesting questions. And good luck to you, Luc, and your team.
Thank you very much.
Thank you.
Bye. Good evening.